This is a special AHRMM podcast as we speak with session presenters and keynote speakers direct from the show floor at the Music City Center in Nashville for AHRMM. I'm Bill Klaproth. With me is Boyd B.J. McCleskey, Director of Resource Optimization for McLeod Health. His session, Measuring CQO, a real-world case study in collaboration between supply chain and surgical teams. BJ, thank you so much for your time. We appreciate you being here. So let's jump into this. I guess what's important to know is collaboration across clinical and supply chain teams is critical. Tell us about that.
Yeah, I think it's really important to us, especially in healthcare with the current environment around reimbursements and cost, that dialogue between the supply chain team and the clinical team and that full transparency. It was very important, and what it did is it led to a tool, a platform that allowed us to better get data into our decision makers' hands and ultimately let them have the data to understand what it is that they're doing and how they're impacting not only our patients but our organization from a financial standpoint.
So tell us how you did this. How did you improve this collaboration between clinical and supply chain? How did you do that for someone listening going, I need to do that at my institution? How did you do that?
Yeah, we engage with stakeholders across the continuum. So those stakeholders would be our physicians or our operators, whether that was supply chain, finance, quality departments. We pulled everybody together to understand what data was really meaningful to them, what data was relevant, and what data could we utilize to then turn actionable and then be able to measure it. It was a really simple approach, but we engaged the people that, the teams that we needed to engage, understand what we needed to get from a data perspective, and then as we got it, the question became, well, all right, now we have the data, what do we do with it? Healthcare is data rich. There's so much data. The problem we ran into is our data was segmented between our EHR, ERP, our point of view systems, our quality reporting systems, our finance systems. So it was really important to, once we got the data that they were looking for, work with them to figure out how to put it into a single platform that then became actionable. So our physicians weighed in and said, I need to understand these data points when it came to length of stay or smoking status or diabetic status, or how did those things impact my operating margins. They got to weigh in and actually build out this platform in a way that was meaningful for them, just like supply chain did the same thing. These are the data elements that we need to see, and this is how we utilize those data elements. So it was working with that team, simplistic approach, but it was working with each one of these stakeholders to understand how do we get that data to a place that we can then make the best decision and then measure it after the fact.
You also used the term engagement. How did you engage these different teams? What were some of the tactics that you used to build collaboration?
I think it was building a burning platform. I think with the current healthcare environment, it was really having everybody understand the reasons why. We actually elected to go with a pilot around our total knee arthroplasties, and that was very strategic for us with all the changes with the bundle payments that we were asked to be a part of or told to be a part of, with those joints going strictly outpatient. All those things were putting a lot of pressure on us from a cost standpoint. Some of us knew and others didn't, so building that engagement was part of that. Transparency was part of building that engagement, have everybody understand the reason why we need to come together and to work on this as a team across the continuum from operator to physician. So,
you also talked about the segmented data and how important that data is. Tell us how you went about making that data more, maybe not reliable, but more relative to what you needed to be for the certain teams. How did you work the data to make it work better for you?
That was the ticketed item with this entire experiment. Our data wasn't great, to be honest with you. We started pulling data from all those respective systems, 5, 6 different systems, and when you integrate all that data integrity becomes a huge part of that process. So we actually had to spend a lot of time, a lot of resources that we did not initially anticipate having to spend. So it took us a little bit longer to get where we needed to go, but our reason for action was to get the information into our decision makers' hands as real time as possible so that they can stay relevant on their decisions, make the best decisions for quality care for our patients. And we knew that this tool wasn't meant to be directional. This tool was actually there to provide decision-making capabilities. So we actually had to farm out each one of those respective areas to subject matter experts. So for myself in supply chain and value analysis, I was responsible for our clinical utilization data, so all the consumption coming out of our procedural areas. I had to validate, I had to vet that data, and then I had to make it available to be integrated into our single platform. And then we have people from our quality department doing the same thing, people from our finance department doing the same thing. So we each owned our respective areas and then made that data available to come back to the group.
Right. And what has the outcome been so far with this collaborative building environment and the better data? You said data integrity. What's been the outcome of this?
It's been really positive across the board. Our physicians have been asking for a long time for transparency. They want to know how much things cost. They want to know how their decisions to change a widget or a piece of equipment, or how does that impact the outcomes of what they're doing. The overall has been really good. There's also been a few aha or surprise moments along the way from each one of the respective areas. For myself personally, I think we went into this from a financial standpoint, but when we started getting all the data integrated and started to get some of these insights coming back out to us, we started asking a different question: is should we be focused on cost? Not that we are supply chain, so we have to do that, but we started seeing within the data how one facility of ours was performing much better from an operational margin standpoint than another, and it was the smallest little bit of payer mix difference between the two facilities. Everything from an outcome standpoint was relatively the same. They were in line from an outcome standpoint, from the cost of device standpoint, but there's this little bit of payer mix that was really driving our operating margins in one location. So I think it's those things, those unexpected insights that have started to pour out through this data integration that has everybody excited about the direction we're going.
Yeah, that's really cool. You talk about data integrity and how you learned that and how you uncovered something that was really important to you, an added insight. So really important when you put the work and time into the data, it's interesting what it'll show you, right?
Absolutely. Yeah, and that was just one example. I think we did this initiative strategically because of a strategic sourcing engagement we went through with the same orthopedic group around joint implants. We were expecting to measure our financial impacts. We think if, all right, we just cut $1 million, if that's the number you cut, if we just cut $1 million off of this contract and the spend, we expect to see $1 million hit the bottom line. Well, if you ever try to track that back through your financials and your P&L statements, it doesn't always translate. So this tool gave us the ability to see all those multivariable pieces of the equation that help explain why we saw some and maybe not all, or why we are seeing opportunity on revenue and maybe not opportunity on cost. It was really good and insightful.
Yeah, well, this is insightful, and I know that people have a lot to learn from what you went through. So thank you for your time, BJ. Is there anything else you'd like to add?
I think the only thing I'd like to add is if you're maybe not doing this or just starting out doing this, be bold to engage your physicians. I think that's the biggest hurdle, is just to get the conversation started. Even if you don't have all the data. We had the data, but our data wasn't good. We had to work on that data. So don't let those things deter you. Go ahead and get engaged with your stakeholders and your decision makers, because at the end of the day, they want the same thing we want. We want the same thing they do. We want to drive quality, excellent care for our patients. We want the newest, greatest technology available and in the hands of our operators. But we want to do it where we're eliminating unwanted cost. We want to do that, and they want to do that as well. So when you start having those conversations and realize we're working towards the same goals, you can start to get past those things around the data problems or the transparency problems. So I think that would be how I'd encourage everybody.
Absolutely. Well, thank you again for your time. I like that. Be bold and engage your physicians. I like that. We need more of that. So, BJ, thank you again. We appreciate it.
Yep, thank you.
And that is BJ McCluskey. And for more education like this, please go to the AHRMM Knowledge Center at arm.org/knowledge-center. Thanks for listening.